Okay, so the title of my talk today is Brains Under Attack, the Epidemic of Inflammatory Neurobehavioral Disorders in Children, What's Causing Them and How to Reverse Them. So I know that seems like quite a mouthful for a title of a talk, and I'll get into some details about what I think is a very under-recognized epidemic that's happening in our kids, and something that we can actually do a whole lot about if we just understand a little bit more about what's happening. Before we get into that specifically, just a little bit of background. As was mentioned, these are a couple of books that I've authored around children's health and what I call the new childhood epidemics, which are these conditions that didn't exist, a few decades ago in great numbers: autism, ADHD, asthma, allergies, type 2 diabetes, all these kinds of things that were very rare in children, but now seem to be the norm. So we now have 1 in 2 American children with a diagnosed chronic health condition. And many of these conditions have a neuroinflammatory component, and that's going to be the focus of my talk today. So the neuroinflammatory term is almost a little bit jarring or concerning. What does that mean to have a neuroinflammatory condition? It really just means what that word sounds like: brain inflammation, neuroinflammation, inflammation that affects the central nervous system or the brain. So what's interesting is that there are very many conditions that have a neuroinflammatory conditions that most people don't even know that there's a neuroinflammatory condition. So conditions like depression, anxiety, mood disorders, ADHD, even eating disorders, and tics, Tourette syndrome, PANS and PANDAS, which I'm really going to go into deep today, autism spectrum disorders. These conditions, even though they seem like they are mental health conditions or psychiatric conditions, that's sort of how we understand them, there is a neuroinflammatory component to these conditions. And in older populations, these conditions look like Alzheimer's or Parkinson's or MS. So these are across the spectrum, across the age spectrum, but I'm going to focus specifically about children's conditions today. So again, these are conditions that were once believed to be psychiatric or mental health or mood disorders or behavioral, because a lot of times in children in particular, these conditions present as odd or irregular behavior, concerning behaviors. And so sometimes that ends up having psychologists deal with these or psychiatrists deal with these. But what I want to talk about is the underlying medical conditions in these disorders. So we have to start thinking about these conditions as whole body conditions. So in the past, these would again mostly be handled in sort of the mental health sphere. But now, increasingly, they're being looked at by practitioners who practice functional medicine, integrative medicine, holistic, whole body kinds of approaches. And we're now understanding that they are very much mediated by the immune system. They are really closely tied to the gut and the health of the gut. So something that's been well established in the last few years or decade plus is this connection between the gut and the brain. It's known as the gut-brain axis. The immune system is housed in the gut. So we really need to look at the whole body, what's happening in the gut, before we can understand what's happening in the brain in these neuroinflammatory and neurobehavioral conditions. The ones in children in particular, again, I think there's a real risk of these children not getting proper treatment when they're seen primarily as behavioral. So ADHD, I can't focus, I can't pay attention in class, or, I'm fidgety, or I can't sit still. That seems behavioral. And so oftentimes we end up managing these things, again, through things like cognitive behavioral therapy, or psychiatrists or psychologists are helping provide supports, which can be helpful, but it isn't getting to the root causes. So that's the risk we run. And especially because it's children, it's so much about children's behavior and what they do and the symptoms they express. This can be reflected in this idea that parenting is involved, which of course parenting is involved, but I'm just trying to point out that it's not the whole picture. There's way more going on with these kids who have significant behavioral problems or significant behavioral issues, especially when they have one of these types of diagnoses. So I'm going to dive into a condition called PANS. So PANS is relatively new. You may not be familiar with it. It really started coming to our awareness in the late 1990s. PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome, which is also a mouthful. And there is an associated condition that's called PANDAS, which is a little bit more specific. This is pediatric autoimmune neuropsychiatric disorders associated with streptococcus bacteria. So these are, PANS is kind of an umbrella term, and PANDAS is a specific type of PANS. I'll explain a little bit more about the symptoms, but this is a class of conditions that are autoimmune in nature. So if you look at the chart on the right, what's happening in these conditions is that these children are experiencing autoimmune encephalopathy. And that means that the immune system is attacking the brain and causing inflammation in the brain. Again, neuroinflammation. Or it could be in the central nervous system in general. So because what happens is the immune system is attacking tissue in the brain where certain functions happen and certain processes are going on, it's disrupting behavior, mood, all these kinds of things that, again, you thought were sort of just in this, separate from the body. These are things that are occurring because the brain is under attack by the immune system. So this includes conditions like OCD, which is obsessive compulsive disorder. It includes conditions like anxiety, eating disorders, tics, Tourette syndrome. They're all in this field of autoimmune encephalopathy. So PANS and PANDAS are really interesting, almost like a prism that you can look through and see a whole window into what's happening to our children in general, in terms of their being impacted with this whole new cluster of diagnoses that didn't used to exist just a few decades ago in any great numbers. So I like to look at PANS and PANDAS as a window into what's happening to our kids, because it's oftentimes sudden, meaning that you have children who are developing normally along a traditional developmental trajectory, and then they suddenly develop these new symptoms, these new psychiatric symptoms. So something happened, right? Something triggered. So it isn't conceived of as genetic or that they've always had this. There's something environmental going on. And I think that's really important for us to understand, because all of these conditions, whether they're ADHD or autism or OCD or anxiety, they all have maybe a genetic component, but the environmental piece is massively important. And when you look at a condition like PANS and PANDAS that has a sudden onset, that tells us something in the environment changed or something in their body changed. So let's take a deep dive and look into that so we can understand all of these conditions. So I'm going to do a deep dive on PANS and PANDAS, again, because it gives us so much insight into all of these conditions. So what are the symptoms of PANS? Another term is autoimmune encephalitis. So PANS, PANDAS, and autoimmune encephalitis. Anxiety is a hallmark of these conditions. Children who are normally kind of calm, cool, collected kids suddenly feeling like they can't separate from mom, or they're terrified if dad goes away on a trip. Mood swings, red rage, like screaming, tantruming, kind of intense behavioral reactions to things that typically, again, is new. Emotional lability, depression. A lot of that times these children will develop suicidal ideation out of nowhere. All of a sudden they hate themselves and they want to kill themselves. And, again, these are normally developing kids who never had these kinds of things, and all of a sudden are having these really strange and odd behaviors. Irritability, aggression. Sensory abnormalities are a massive part of this. You will see children who normally ate, typically lots of different types of foods, all of a sudden develop severe food aversions, and they can't stand the sound of somebody chewing food, or they can't stand the feeling of food in their mouths, and oftentimes develop anorexia and will lose significant amounts of weight. So another common feature is that you'll see children with behavioral regressions. So they may, for instance, begin bedwetting, or they may begin baby talking. And imagine a parent who has, a child that's 8, 9, 10, who's just been a typical kid, and all of a sudden they start baby talking and bedwetting, and they lose their ability to write. This is a very concerning condition for parents, and it's terrifying for them. Another feature is tics. So you saw a moment ago that I had that overlap where you saw tics and Tourette syndrome. So physical tics like hair pulling, shoulder shrugging, blinking, coughing, or throat clearing. You might see a lot of that, and it gets repetitive and constant. There's also sleep disturbances, insomnia happens, obsessive compulsive behaviors develop, and sometimes when it's really severe, you'll even have auditory or visual hallucinations. So the thing that's most concerning to me is, I've been looking at this condition for about 10 years, and I have met many parents who had this experience where their child basically became what they would describe as suddenly crazy or psychotic. And these are words that are commonly used by parents. Another thing is, this is not my child. I don't know what happened to my child. And many times these children are admitted into psychiatric wards in hospitals because nobody knows what to do with this child. They're having a psychotic break. They're in psychosis. And it's absolutely life-changing for these families. Some of the milder cases that might be seen as, like a little obsessive compulsive type behavior, or a little tic, or, a little red rage crops up then and there. And that kind of thing is, it slides by, it doesn't necessarily get a diagnosis, but it's kind of almost like the milder version of PANS and PANDAS, where they might manage it with cognitive behavioral therapy or some of the other tools that psychologists and psychiatrists use. And so they're not going to get the treatment that maybe they ought to. But what you're looking at here on the slide is a documentary film that looks into PANS and PANDAS. This is a film called My Kid Is Not Crazy. And I think that's such a appropriate title, because that's exactly what these parents go through, is this experience of like, their child was fine, and then all of a sudden they started acting crazy, and the parents are desperate to say, this is not my child. My child is not crazy. But people don't necessarily know their child. And so all they see is a psychosis, and then they treat them as really a mental health abnormality or a mental health anomaly. And we need to look deeper into what's causing these behaviors in children so that they can get the help that they need. So how common are these conditions in our children? There's no doubt that all of these conditions I've mentioned, all these neuroinflammatory, neurobehavioral, and neurodevelopmental conditions, are on the rise. Autism would be, of course, the one that people talk the most about. Autism was about 1 in 10,000 in the 1970s, and now we're at 1 in 44. Some epidemiological studies even put it at 1 in 30 kids in the United States. So this is something that has a lot of debate around it. There is no question that this is better diagnosed. We know that we are doing a much better job finding kids and diagnosing them early, especially, but it doesn't explain the absolute skyrocketing rate of this condition, and it's continuing to grow every year. PANS and PANDAS, nobody actually really knows how many kids are impacted with PANS and PANDAS, and that's partly because people are not diagnosing it still. Meaning, as I just described, when these kids have these psychotic episodes, or they develop these kinds of OCDs, problems, or tics, a lot of the pediatricians never learned about this in medical school. And so they don't diagnose this, and we're not doing a good job tracking these kids. So Sue Swato and the NIH, Sue Swato, who was at the NIH, did a really good job bringing awareness to this condition to the medical community, but it still really hasn't permeated into most practices. So the estimates are about 1 in 200 children, but I think that's a very low estimate, and it affects many more children than that. And the other thing that's hard to do with epidemiology is the overlapping diagnoses. So, a child might get an anorexia diagnosis or an OCD diagnosis, but not a PANDAS diagnosis. So because there's that overlap, it's hard to know exactly how many kids have PANS or PANDAS. It's estimated about 1 in 162 children are diagnosed with Tourette syndrome, which is actually, that's pretty well known and pretty well established. So that seems to be a more accurate number. And then, there's many more conditions. There's depression, there's anxiety, ADHD, which again, is one of those things that always surprises people, to think of ADHD as a neuroinflammatory condition or neurobehavioral inflammatory condition, but there's absolutely inflammation going on with that condition as well. And it's extremely prevalent in American society today.